The prior authorization process for medications like Humatrope can feel like wading through a maze of paperwork and insurance jargon. But here's the good news. It doesn't have to be that complicated. Whether you're a doctor, office manager, or patient advocate, understanding how the system works can save you time and make sure patients get the care they need without unnecessary delays. So let's break it down and make the process a little less overwhelming. First, let's talk about insurance requirements. Providers like Aetna, Cigna, and Blue Cross Blue Shield each have their own guidelines for medications like Humatrope. Understanding these rules is key to making sure things go smoothly. Check whether Humatrope is covered under the patient's plan, what documentation is needed, and whether there are specific review timelines. You can usually get all this info directly from the insurance provider or by looking at their provider manual. So why does Humatrope need prior authorization? Well, Humatrope is a synthetic growth hormone used for conditions like growth hormone deficiency, Turner syndrome, and idiopathic short stature. Insurance companies need to review each request to make sure the treatment is medically necessary. They want to provide access to these life-changing therapies, but also need to keep costs in check. And that's where good documentation comes in. The clearer and more accurate your information, the smoother the process will go. Now let's walk through the process step by step. Before diving into paperwork, make sure Humatrope is covered by the patient's insurance. You'll need to know the specific coverage criteria, what documentation is required, and if there are any preferred brands of somatropin that might need a formulary exception. Once coverage is confirmed, team up with the prescribing doctor to gather all the necessary clinical evidence. This usually means getting a detailed diagnosis, like growth hormone deficiency or Turner syndrome, relevant test results, like growth hormone stimulation tests, and treatment history, including responses to previous therapies. Now that you have all the info, submit the prior authorization request. You'll need to include the prior authorization form, medical records, lab results, and a letter of medical necessity from the doctor. Insurance companies rely heavily on accurate coding, so make sure to use the correct ICD-10 and CPT codes. Getting this right can help avoid unnecessary delays or denials. Don't just submit everything and wait. Check in with the insurance company to see where the request stands. A quick follow-up can save you time and keep things moving forward. If your request is denied, don't panic. Look over the denial letter to understand the reasons for rejection. You can often appeal the decision by submitting additional documentation or updated information. Many insurers also offer peer-to-peer reviews where the prescribing physician can discuss the case directly with a medical reviewer. It's all about preparation, accuracy, and communication. And remember, if you need help managing the paperwork and insurance verifications, services like Staffingly, Inc. are there to lighten the load and make the process a whole lot easier.
If you are looking for outsourcing services, schedule a demo today by visiting www.staffingly.com or emailing us at support@staffingly.com or call us on the number 1-800-489-5877.